Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. What a wintry day we have outside. It's cold. It's ugly. It's actually very pretty outside, but it's cold. Bundle up and stay warm. These are the kind of days that you can get sick. You go outside and the wind blows and you get wind chill right in the back of your neck, and next thing you know, you got upper respiratory problem. Be careful. Bundle up. Make sure your head's covered and your neck is covered and you got gloves on your hands, and that'll probably take care of it, even if you have something on light, over your chest. But stay warm, because the consequence is not something that you want to deal with. Cold season, flu season, it's upon us. And even though that a lot of you went out and got your flu shot, your vaccination, so to protect you from that flu and that nastiness that comes, these few months of the year, I got news for you. Doesn't work. Yep, that's the deal. Guess what the average effectiveness is of the flu vaccine? Somewhere between 9% all the way up to maybe, at a good year, 38%. That's the statistics, my friends. You have a better shot of rolling the dice and doing nothing. If you want to increase your immunological response, there are things that you can do, and they're really very simple. Why do you think you get sick this time of year? Let's take it from that perspective. We get sick simply because of the fact that we abuse ourselves. You abuse yourself. The holiday season's upon us. It started at what? Halloween, with all the sugars and the junk that's out there. We start inundating our bodies with all kinds of things that we normally wouldn't touch, at least at the levels that we do. Remember I said over time, if you've listened to me lecture, that the average consumption of sugar per person per year annually in this country is about 170 pounds of sugar per person. That's a whole lot of sweet stuff going in your body, and I don't get a lot of it, so who's getting my share? So you increase that, and you realize that 1 teaspoon of sugar, 1 teaspoon of white sugar, the equivalent, decreases the white blood cell capacity to fight, to help you, by up to 12% for 8 hours. You put it to sleep. It's dormant. If you did a blood smear and you looked at the white blood cells, they're there. They're just comatose. They're out to lunch. So when you start stuffing yourself between now and New Year's, and you start putting things in your body that you normally wouldn't do, and you party and you stay up late and you're exposed to the winter elements, and there's not enough sun out there to stimulate your vitamin D, is it any wonder why so many people get sick and never pull out of it after the holiday season? Not a good thing. Give me a call today, 888-630-9625. That's 888-630-9625. Perhaps you've had a problem. You've tried, you've applied. Well, here's an opportunity. Let's talk about your things today. I have a couple of things that I'll discuss with you, but nevertheless, let's talk about what makes you well and strong and potentiates longevity over a period of many years. A lot of people don't get sick, and we always wonder why that happens. Well, success leaves a trail. And if you take the opportunity and watch people who stay healthy, generally, there's exceptions to the rules. There's a guy out there that drinks a quart of whiskey a day and smokes a pack of cigarettes and does everything he shouldn't be doing, lives to 99 and dies in his sleep. Well, the rest of us don't make it that way. We kind of, we do that kind of nonsense. We pay a huge price. So I'm talking to, the 98% of you out there that really need to take stock in what you do on a day-to-day basis, because if you don't, you're going to pay a price, and the price sometimes is very ugly, from just the cold to cancer. And we're going to get into a little bit of cancer today and the prevention of it, because for whatever reason, It's been running in our office lately. We've seen so many people with many different forms of cancers, from breast cancer, both men and women, to bone metastases, to things that you just wouldn't expect, and pancreatic cancers and glial cell cancers of the brain. Why is that? Why are we being irritated? And I use the term irritation because we're talking about a genetic specific marker that is being kicked in many of these conditions to allow you to be sick and to show the symptoms of cancer, and cancer is a symptom. But let's talk about immune function first, and let's talk about the things that you're doing now and the things that you're going to do over the next couple of months that really are going to set the stage for a lot of these things to be activated. And that's really what it is. The underlying piece is a triggering mechanism. So you go along life and limping along, and you're young, and you expose yourself to this, and you drink that, and you eat that, and you don't think anything can touch you until one day, all of a sudden you don't feel good. And you go to the doctor and you say, "Hey, doc, I don't feel good." And he says, "Well, how don't you feel?" And I'm tired, and I kind of ache all over and so forth. So, well, take these pills, and let's see how it works. And sometimes it's an antibiotic, sometimes it's a mood modulator of some sort, sometimes it's something to upregulate your energetics in your body. And you go limp along for a while, and you go back and you complain a little bit more, and you say, "Hey, doc, I don't feel good." And he says, "Well, how don't you feel?" And he said, "Well, I'm developing this inability to sleep, and I'm short of breath, and I've noticed that my heart is skipping around." And say, "Well, let's give you these pills, and let's see if that works, and I'll see you in a few months." So you come back a few months later, maybe a year or so later, and you say, "Hey, doc, I don't feel good." And he says, "Why? What is it that you don't feel?" And so you start expressing symptoms of muscle cramping, and you're not digesting well, and you bloat up after every meal, and you can't figure out why that is, and it's worse at nighttime. And you go along, and then pretty soon you go back to the doc, and you say, "Hey, doc, I don't feel good." And he said, "Well, you're at a place now you're going to have to take these pills for the rest of your life." There's something wrong with that matrix. There's a problem there. And, the years that I've been in practice, and I've been doing this now 37 years, and patients come in to me, and they're so set in acceptance of this stupid paradigm that says that you have to take these pills for the rest of your life. What do you expect for your age? And there's nothing that you can do to change it, because God knows that food is food and air is air, and it doesn't make any difference whether you exercise or you don't, and how you run your brain and so forth. And at that point, I want to say, really? There's so much that we do that is something that will cause a problem and something that will eliminate a problem, except that we don't get it, we don't understand. That's why I wrote my book, Ageless Health. Health is a do-it-yourself program, because truly is. You are the captain of your ship. You're the one that makes the choices. You buy into the Fifth Avenue marketing. You listen to all the talking heads out there that tell you that, well, what do you expect for your age? And, whether it's a drug-induced coma to drop some type of high reactive something or other, like your blood pressure, or your heart's flipping around, you're throwing out all kinds of extra contractions in your heart. Why did that happen? Why did it pick out you? And then all of a sudden you take something like Toprol and, to calm things down, but it has a lot of interesting side effects as well. Or you take a blood pressure medication that is a diuretic, and you start throwing out all your potassium, so you feel weak and, you don't have any stamina. Or, over the years we're exposed to different types of electromagnetics, the water we drink, the estrogens that we have, and guys are out there now that have absolutely no testosterone and no libido because of their environment, because of the way they think, the way they're running their bodies. I said the way you think, because remember we talked about structural, chemical, emotional. That wasn't a side slip on my part. We do those things to ourselves, and we buy into the paradigm. And God forbid that we say that we want to be well and healthy and have blood pressure about 116 over 68, and we want to be able to walk 3 to 5 miles without any problems, and we want to feel good, and we want to have energy. But in the meantime, we stop at all the fast food restaurants, and we're always shoving junk in our body. We have to have that cocktail at the end of the day instead of going out and maybe doing some praying or some meditation. It's beyond me why people don't get that they get sick. And this is the time of the year that it's profound, because we link this time of the year to depression. We link this time of the year to dietary insufficiency. We add this time of the year to lack of activity and no sunlight and cold and hot and cold, and our bodies are being challenged. So why did I get on this tirade today? Why am I expressing all this to you? Simply because of the fact that for whatever reason this week, it got to me. And I'm sitting there dealing with my patients, who I love desperately, and I want to help them, and I want to do everything that I can to make a difference in their lives. And, it comes down to that structural, chemical, emotional triad, and how we ignore it in so many cases, and how simple it is to turn things around if you really want to turn them around. So what we're going to talk about today is some of the things that you can do to make a difference between now and January, February, so you don't get sick, and that you maintain a level of commitment to yourself, realizing that you do have control, the capacity to fix almost anything that takes place other than maybe a gunshot to the head. And, if you have that, you don't have to worry about it anyway. The times of suffering are over with. But nevertheless, most of us are not going to experience that, so we have to understand that we have control. So if you buy into what I'm talking about, if you really get that, so let's jump into an immune situation that all of you will recognize and get your attention. And what's that? That's cancer. So cancer is, by many authors, the last way that the body tries to activate your immunological process. It's the fail-safe. It's like it kicks everything in all at one time. The problem is that most of your immune systems at that point are shot, and they won't kick back in. So subsequently, you run around and you start putting all kinds of chemotherapeutics and radiation in your body, which is designed to try to kill the cancer before the radiation, the chemotherapy, kills you. There has to be a better way, right? There has to be a way to fix things better. Well, take a look at your diet. How many of you, if I said my mantra, sugars, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, could say yes, 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 and yes? And that when it comes to meats, you eat way too many meats, and you throw a lot of pork in your body. And most of your foods are not only refined, but they're inundated with all kinds of toxic additives to them. In today's world, they're genetically modified, and you're sitting there and saying, and what does this have to do with anything? I thought food was food. Well, there's some excellent books out there that I think you need to start making yourself aware of. One of them is called Seeds of Deception. I've talked about it before, and it's talked about what Monsanto and its brothers are doing to your food supply, and actually creating your food to produce its own Roundup. Isn't that cool? You can eat something that has genetically been modified to produce Roundup, and do you think that doesn't have an effect on your body? Well, guess what? We know that Roundup is carcinogenic, and if it's already in your foods and you're consuming that, well, we have issues. We have problems. And, if you're not getting the right type of oils, and they're all saturated trans fats, and, they're causing oxidative stress reactions in your body, so your body's cellular levels are going crazy, we've got to be able to do something about that. So, cancer. We're going to talk about that. Cancer cells are present, in all of us at one time or another. That's right. Guess what? Most of us will go in and out of cancer multiple times throughout our lives. It's when your immune system can't handle it is when you get sick, and meaning when the cancer starts growing and spreading, you develop tumors, and you have a problem, and your doctor says finally, well, we're going to do what we do, and that's drug you to death and radiate your body, and hopefully we'll give you a little bit more time. What a way to live, right? What an incredible way to continue your lifespan. I don't know, but, I don't think I'm all in about that. And then we say, well, I don't eat, I'm a vegan, I'm a vegetarian. Well, vegetarian really means that you not just eliminate animal proteins, but you're eating a ton of vegetable proteins on a day-to-day basis. Most of you think that a Twinkie or a soda or a piece of bread or, peanut butter and jelly is a vegan lifestyle. Well, I got news for you. There's not so much that is going to support you within those choices, and you have to make a choice that is different than that. How many like to throw a piece of meat on the grill and burn the outside crisp? Well, that's not a good thing, because that's going to dramatically increase your risk of degenerative oxidative stress in your body and increase your risk of cancer. So where do we go from that? Well, we're going to cover that quite a bit in today's program in a lot of different things, but I want your questions. I want to talk to you about your problems, the colds that you're coming down with, the body aches that you have, the I don't feel good, the lack of energy, the potential cancer problems that you have, how you're being treated. Maybe I can guide you just a little bit differently than you've thought about up until now. We've got to take a break and pay respect to a lot of people who support Dr. Tom Roselle Live. I'll be here for you in just a minute. Don't go away.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. Love to talk to you. Have a lot of things I want to share with you today, and, staying well is part of it, and what you're doing to break your body down is part of it, but I want to give you the fix to that. We're coming up with nasty flu season and all the things that you're going to deprive your body of, destroy your body with, and totally cause yourself all kinds of angst because of why. Well, we started with, as I said earlier, with Halloween, and we're going to Thanksgiving this week, and then we're going to go to the Christmas holidays, and we're going to soon be in Hanukkah and New Year's, and that kind of stuff. And then it goes all the way to, if we haven't done enough, then we'll get to Valentine's Day. Think about all those holidays. Think about all the junk you're putting in your body between now and then. Think about the cold weather. Think about the lack of sunlight. Think about the sleep you don't get. And you wonder why you get sick, right? Well, there's several articles out there that, gets people's attention. And Life Extension magazine is one that puts all kinds of things in front of you and say, take these supplements to do this, that, and the other thing. And, they do some very decent research, but they act in the nutrition field like the drug companies act in the drug field. And sometimes they put out some really good articles, and sometimes I really have a problem with them. And I'm not going to get into the problematic end of it today, but I'm going to talk a little bit about an article that was brought to my attention this week with patients. And, they're always getting there, take this to increase your immune system, and you'll reduce the risk of common cold or the flu and so forth. And one of them that they put out this last week or so was boosting your immune system, but they also boosting vaccine effectiveness. And we could spend the rest of the program on that because, in my opinion, vaccines are probably one of the worst things that you can do to yourself. Not a cool thing, because what they're actually telling you, if you read through the article and you ask some very, very salient questions, is that it's not the vaccine that's working. It's the other things that they're telling you that can make a difference. And we're going to talk about that. And they talked about glutathione, and they talked about couple amino acids. One's L-theanine, and the other one's L-cysteine. And they are immune increasers in the body, enhancers, if you will, and I'll tell you why in a little bit. But before we do that, I want to go to the phones. Remember, our number here is 888-630-9625. Give me a call. I'd love to talk to you. And how you find me off the air, you go to rosellecare.com. That's ROSELLECARE.com. And if you'd like to talk to one of my staff, all you have to do is go 703-698-7117 and tell whoever answers the phone that you'd like to talk to one of my doctors about whatever it is, and they'll call you back. They'll get that done. Colette, thanks for calling. How can I help?
Last June, I had a trigger finger from using I work in the library from the heavy books and those.
Yes.
Anyway, I went to the doctor. He gave me cortisone shot on my thumb.
Yeah, typical treatment.
Yeah, that was the trigger finger. But now it is again the same thing, and it's hurting, and I went to the doctor again. He told me probably there is a ligament tear. So he's going to have me to have an MRI.
No, let me tell you about trigger fingers, okay? They're very common. And it's, for our audience, and you already know what it is when your thumb or your forefinger will lock in position, and then you have to kind of snap it back, and it locks back down, and you have to snap it back. They can be painful, or they can just be an irritation. But in this particular situation, when they inject cortisone in any joint space, they're going to irritate the joint space. They're going to break it down even more. That's one of the dangers of doing that. But a trigger finger comes about because of the muscle and the ligaments around the wrist, the hand that go into the fingers not firing properly. So you've been doing things repetitively. You have 8 little bones in your wrist called the carpal bones. You have 2 long bones going down towards the wrist called the radius and the ulna. And then you have all these long bones in your hands. Sometimes just because of the work that you do, you tighten the muscles down. Some muscles become more tight than they should. Some muscles become more relaxed than what they should, so they're not cooperating. They're not firing the way they need to fire. We see these things all the time. They're very fixable. You have to mobilize and take care of these 8 little bones. Sometimes they even start as far as the shoulder or the neck, and if the nerve is irritated in the neck, it's going to affect the muscles all the way down into the arm and into the fingers.
Yeah.
But if you fix it, it doesn't come back unless you re-irritate it the way you were, doing what you're doing. A lot of people, they're on a mouse on a computer. I use my hands every day when I'm with my patients, and I've had several trigger fingers over the years, and fortunately my docs know how to fix them. They get it done, it's over with, and then I can go back doing what I'm doing. But I would not, you're going to go through a lot of stuff. The next thing is going to tell you that they have to do surgery to cut the ligament, to open it up, to relax the thumb. Don't do it. There's too many things you can do to get that fixed. You live in Rockville.
Yeah.
You can give me a call. Just actually get a hold of me on the internet, and you can either come to us or I will make a referral for you to somebody that I know that can fix that in Rockville.
Great.
But please do not let anybody cut you, because it's not necessary. You can get it fixed, and there's a lot that you can do to prevent these things from coming. Colette, thank you for calling. I appreciate it.
Thank you.
You're welcome. Do not let anybody cut you when you have a trigger finger. It is unnecessary. It's the same thing with the majority of carpal tunnel patterns and all of those things. You can fix them. You just have to ask the question why they got there in the first place. Remember, it's ligaments, muscles, nerves, bones, and joints. And basically what happens is they're not moving the way they're supposed to, designed to do, or created to do. And if you ask the question, why is that, you can actually get it fixed. We're coming up to the news and some important information. Don't go away. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. 888-630-9625. Love to talk to you on any subjects that you have in mind. We're here. We're going to try to get into a few things about your immune system today and why things are as they are. But you know what? The bottom line is that you have a hand in it. You are responsible. Remember my book, Ageless Health, Health is a Do-It-Yourself program, lays it out step by step, what you can do proactively to help yourself. And by the way, if you don't have a copy of it, you should. And with the holidays coming up, what an amazing gift that you could give to somebody. The book and also the audio version. And by the way, the Ageless Health PBS TV special, 2 times nominated for an Academy or for award, Emmy Award. It's available online. You can get it by going to our website, rosellecare.com, or you can go to Amazon and get it as well. It's available either place. Let me know if you do get it and if you enjoyed it. And, your commentaries are always very, very readily accepted. I want to go back to the phones. Timothy, thank you for calling.
Hey, just a question. You're talking about cancer and immune systems. And I read the other day that 90% of the population is iodine deficient, and a lot of our staple foods have been iodine has been taken out, and it's been putting like bromine and other halogens like fluoride in our food that attack our thyroids and our immune system.
That's right.
So I was wondering what's a good way to put iodine back to our bodies to help prevent cancers and other sorts of...
Well, the first thing that you have to talk about is your mention of the halides, the bromides, and they're very, very caustic to the system. They bind at the iodine sites. That's one of the reasons that we have such iodine deficiencies, is because these halides are competing for that receptor site. And so once they're in there, the iodine, even if you have it available, can't get in. So instead of, the old days when they enhanced your bread with iodine, now they're putting bromines in it, and they're actually spraying your crops with it because it's a preservative. But nevertheless, you have a side effect, and that is things like Hashimoto's thyroiditis and autoimmune problems and suppressions. So unless you're eating organic foods, there's no way to avoid the bromides. They're all over the place. The smell that you get in a new car, that's a bromide. That's a halide. And, so when you buy that new car and you like that smell, well, you just cause your thyroid a whole lot of trouble. So having said that, the other problem is that the fish that we grow today are being raised for the most part. I don't eat anything but wild fish. And the farm-raised fish, and you go out and get salmon, if it doesn't say wild caught, it's not. And there's all kinds of ugly things that they're feeding these animals or these fish, and bromides are one of them that are mixed into this mess that they give them. So where you should be getting your iodine from, you can't. And so where do you get it? First of all, go to the health food store. Potassium iodide and sodium iodide and potassium iodate are necessary in small amounts, and they're usually the ones that you get in your iodized salt. But the kind of salt that you want to use is sea salt, not regular sodium chloride or table salt. So go get some sea salt, and in that, if it's really straight up sea salt, you'll have some iodine in it just by nature, but you should have it enhanced just a little bit because you're not going to get enough of it. Go to places like Whole Foods and Mom's and Trader Joe's and so forth, and say that you want sea salt. But look on the bottle. Here's the problem with even those most things, they have all kinds of additives and fillers in them. And so unless you're getting one that says sea salt only and then enhanced with some iodine, and potassium iodide is what protects you from radiation, by the way. That's what they told you to go out and buy in case we have a nuclear blast where you get all the fallout and, your thyroid's in trouble. So if you get potassium iodide, that'll help. Low levels, a combination, how much? Authors vary. We encourage our patients to get at least 30 milligrams a day. And it seems, some authors will tell you less, some authors will tell you no. You're going to see an argument in the journals as well that too much iodine can cause Hashimoto's problems. In our experience, with the patients that we treat, not so. The Lancet, the British Medical Journal, the World Health Organization will actually publish studies that are contrary to that. But it's an essential trace element. It's a trace mineral that you have to have. It helps produce thyroid hormones. You can't produce thyroid hormone, thyroxine, T4, without adequate amounts of iodine. So iodine, trace minerals in tyrosine are necessary in adequate amounts to be able to produce T4. Now, T4 is the thyroid hormone, thyroxine, that has to be converted to the active hormone T3. So I know I went off on a tangent a little bit, but the bottom line is that you got to have it. That's some of the reasons why we don't get it in our body, and you can get it by supplementing your diet with a little sea salt, but enhanced with some iodine. Does that help?
You mentioned the fish, and with the Fukushima fallout on the Pacific Ocean, wild fish, a lot of that fish comes from that area. I was wondering, because they're in nature, that could be a problem trying to eat the wild fish. Of course, eating the farm-raised fish is also an issue.
It is. There's no.
I've heard about nascent iodine. I guess it's a more pure form of iodine. Comes in like little bottles called Survival Shield. I found on a website called InfoWars Health. I was wondering what your thoughts are on nascent iodine versus other iodines that you mentioned getting in salt and other sort of iodine.
Well, let me make this statement. No matter how good you are, how organic you are, all of our food stinks across the board, even organic food. Unfortunately, if you want to roll the clock back 50 years ago, it doesn't have the nutrients, it doesn't have the minerals. It's almost impossible, in my opinion, to be purely organic or safe simply because of the runoffs, the air pollution. So no matter where you are, you have susceptibility to that sort of thing. Nathan's supplements is another one of those things that are promoted very, very well. They're not bad. But here's the bottom line. I mean, we can get into, the things that they sell and, the recommendations they make with everything from B6 to iodine and so forth. But here's where I would err. Find the cleanest products that you can get. Why I'm hedging is this, and so you know why. I can't support one product over the other. Yeah. But if you go out and you look for what's organic, where it's produced, if you want to eat fish, I eat wild-caught fish from the northern climates or in areas that come from areas of the ocean that I know that are relatively clean. You're not going to get away from everything. It's just impossible, but you want to get away from as much as you possibly can and get as many vegetables in your diet as you can get your hands on organic vegetables that are that have been farmed as best as they possibly can. It's a tough world. It really is. And if Sue was here, we'd go back and forth with. And there are specific products that we would recommend, and we would do it privately. But there's more than just Nathan's out there. It's a good product. It's not a bad company. It's not a bad process. But just be very careful. There's no one size fits all.
Hey, thanks. I appreciate it.
You're welcome. Thanks for calling. I really appreciate it, Tim. Bye. Sylvie, how can I help you?
Good afternoon. I wanted to ask about Yacon, Y-A-C-O-N. I believe it's a syrup sweetener. I would like to know the good, the bad, and the ugly. I personally I'm not satisfied with, blueberries, strawberries, etc., sweeteners like that. And I wondered if Yacon sweetener would be the least problematic of all, or if honey would be the least problematic. Thank you very much.
Okay, so, it comes from, South America. It comes from the Indies, and there is no one great supplementation. The whole idea with sugars is first very, very small amounts of them. Natural honeys are better than anything else. They are single-chain sugars. They don't have a lot of energy to be broken down to. When you see something that says a low glycemic index, here's the rule. If it tastes sweet in your mouth, it's going to activate all your neurological pathways to handle that. And people who are diabetic who think that they can do well by doing a low sugar something or other that has NutraSweet or any of the other substances in them, your body still recognizes it as sweet. So when you get something like yacon root, and by the way, it's a diuretic if you didn't know that, it works very well to eliminate toxins. It's one of the better functions of this thing. If you're just using the root instead of that as a sweetener, it works on the urinary system, the kidney and the bladders quite significantly. And if you have any kind of urinary problems, it's one of the things that we've recommended over the years, and it can be used as just a straight-up root. You can juice it into small amounts. You take a teaspoonful of it like 3 times a day, and it works very, very well. But having said that, as a sweetener, it's loaded up with something called fructooligosaccharides, which is FOS for short, and it doesn't work well for a lot of people on their stomach. And if you have any tendencies towards diabetes or hypoglycemia, I wouldn't use it because it's still very significant as a sweetener and can trigger a lot of the glycemic pathways that cause your body to stress and not repair themselves. Most diabetics are deficient in things like zinc and B complex and vitamin C and that sort of basic supplementation. So if you put those in your body and you use small amounts occasionally of organic honeys, you probably stay out of trouble. I like to go to natural things first before I go to anything that is suddenly discovered that is the best of the best. It just doesn't work that way. I haven't seen anything out in the marketplace that is a panacea. When somebody tells you it is, I can almost guarantee you it isn't. But going back to the product, yacon has a significant antioxidant property as well. It helps the body fight certain types of degenerative diseases and free radical damage that's within your system. So having said that, be careful. Use the root if you're trying to deal with any of these things. Don't use it as a concentrated sweetener if you have any kind of blood sugar handling problems or you're trying to avoid sweeteners in your diet. Sugar by any other name. I hope that helps a little bit and, put you on a path. Do your research, and if you have any questions, you can also get a hold of me at rosellecare.com. Send me a note. I'll be more than happy to give you my opinion. Thanks for calling, Sylvia. I appreciate the call. 888-630-9625. That's 888-630-9625. Love to talk to you. We're talking about several things. We started on immune function, and I've got a little bit of time left. So let's talk about that article that was in the Life Extensions magazine on, how to reduce the risk of the common cold. Well, if you eliminate all those things we just talked about, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, and you watch the levels of other types of sweeteners, the carbohydrates that go in your body from any source, increase your vegetable levels, and take your vitamin D level. There are authors that will recommend 2,000 to 10,000 units a day. I personally take a lot of vitamin D every day. And I'm not telling you to do that. I'm just telling you I take about 10,000 units every day. And my target range to keep my vitamin D levels at about 75. If you can keep your vitamin D level at 70, 75, your risk of all kinds of things, including cancers, will go down dramatically. Organic green tea is extraordinarily good as a protector, both from viral patterns, but also keeping the immune system very, very strong and very high. 2, 3 cups, 4 cups if you want them a day. Steep them at least 10 minutes. Works really well. L-theanine and cysteine have an effect on T-cell formation in the body. They seem to work very nicely together to increase the body's immunological process. However, having said that, it's just one of those things that are out there. They find, well, if we give somebody this, it seems to work, and it increases the effectiveness of other things. What it's doing is increasing the effectiveness of the body's response to immunological stimulation. And if you're deficient in basic things like B12 and vitamin C and, even iron, those are things that you want to make sure that are an adequate supply. Get your trace minerals and get them from an organic source. Eat well, drink a lot of water. You've heard me say that repetitively. We're going to come back after some very important messages. Don't go away.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, where Washington comes to talk.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here every Sunday, 12 noon at 888-630-9625. The same old place on your dial. Make sure you get a hold of us. Here and off the air, rosellecare.com, ROSELLECARE.com. It's funny. Towards the end of the show, now the panel lights up. We need another hour. So if you have influence with the station, tell them that you want Dr. Tom Roselle Live to continue so we can answer all your questions. But we're not going to get to all of you, unfortunately. John, however, we're going to take your question. How can I help you, sir?
Hi.
Hi.
It is Tom. Thank you for taking my call.
I'm glad to take it. What's going on?
Wonderful. My wife, she has had fibromyalgia, and I have the medicine that she takes, which is tramadol, amitriptyline, is her main medicines.
Yeah, what you're talking about is fibromyalgia. It's called by many different names. Fibromyositis is one, fibromyalgia is another one. And so she has pain a lot of different places in her body, right?
Yeah, and it's mainly in her upper shoulders and arms.
Okay. So
and she's is Spanish heritage.
Okay. So unfortunately, we don't have a lot of time. I wish you had called in a little earlier so I could get into it. But here's the skinny on it.
Uh-huh.
A lot of years ago, I wrote a white paper called Fibromyalgia, the Undisease. And what that really means is that from a medical point of view, they don't know why it comes about. But here's the deal. It's triggered by, when it's ready to show up, it's triggered by either trauma, neurological injury of some sort, an accident, a fall, or a flu or a cold, or a lot of emotional stress, or a combination of those things. It affects the fight-flight system, the adrenal system. From traditional medical point of view, there are no diagnostic tests that prove positive. There's 18 trigger points that, if they're lit up, at least 11 of them, then the combination of no identifiable findings on laboratory work and the 11 out of the 18 trigger points, they tell you that you have fibromyalgia or fibromyositis or fibromyositis. The names are interchangeable. However, here's the skinny on it. Pain doesn't go away for at least 3 to 6 months. It affects all 4 quadrants. It never affects the joint spaces. And the pain is virtually intractable during that period of time. Then it ebbs and flows. It's always there. The underlying process as it becomes chronic, the cells of the muscles, the fibrils, if you will, there's skinny guys and there's fat barrel types of cells, and they become frayed. It looks like a piece of material that if you stretch the material, how it begins, the thread begins to tear a little bit.
Yeah.
That's under microscope, that's what they look like. You're going to see cortisol being dumped at a very, very low level in the urine, still within the normal markers. You're going to see growth hormone shift. There's some subtle indicators, but they don't look at it. And then there's the corresponding systems that begin to break down, thyroid, blood sugar handling, and so forth. So can it be treated? Yes, absolutely it can be treated, but you have to reset a lot of symptoms. The more that you go into the treating the symptomological process, the worse it becomes. I wish I could get into this, because send me a note and I'll give you a complete breakdown on this thing. It's something that can be resolved. I wish we had gotten into it a little sooner, John, but I'll put it in my back of my head and we'll get to it again.
And you call it an undisease?
I call it, yeah, I personally call it an undisease, but it's called fibromyalgia.
Okay, and can we contact you later?
Please do.
Oh, wonderful.
Okay, thank you, John. I appreciate it very much. We're coming to end. We'll see you later. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.